Welcome to Alpha Live. We have a treat for you today. On this episode of Alpha Live, we have an amazing opportunity to speak to two business leaders in a conversation about the importance of strong female leadership in business. Sponsored by Pfizer.
We come from different places. We look different ways.
We live different ways.
We love different ways.
Seriously, bacon? We're coming. All right, let's go. All right.
We worship different ways.
But there's much that we all share.
One shared commitment to one shared calling.
To bring the boldest, brightest thinking
To the search for life-saving cures.
Built on one shared understanding of the power of science.
Come join the many daring different people at Pfizer.
All driven by one shared goal.
All driven to discover the cure.
I have to say, I've seen that video multiple times, and every time I watch it, I just can't help but smile. Today, our guests are Lydia Fonseca, EVP, Chief Digital and Technology Officer, and Nanette Cosero, Global President of Vaccines. So welcome both. I want to read your bios first before we go into a little bit of the journey. So Lydia Fonseca is the Chief Digital and Technology Officer at Pfizer, responsible for enterprise-wide digital, data, and technology strategy and solutions to support the purpose of delivering breakthroughs that change patients' lives. She also leads learning and development and business process excellence. In her prior role, Lydia was CIO at Quest Diagnostics, which is the world's leading provider of diagnostic information services. Under her leadership, Pfizer received the 2021 CIO 100 Award for Digital Innovation in Manufacturing. In 2020, Lydia joined Fast Company's Impact Council, and Pfizer was named one of Fast Company magazine's 100 Best Workplaces for Innovators. She was named to Alpha's 50 Most Powerful Latinas list in 2020 and again in 2021. She was also named 2020 Healthcare Influencer and 2019 Healthcare Transformer by Medical, Marketing, and Media. She received Forbes 2017 CIO Innovation Award, earned her BA from the University of California, Berkeley, and an MBA and Master's Business Informatics from Rotterdam School of Management, Erasmus Graduate School of Business. Lydia is also a member of the Board of Directors of Tenga, Inc., and was previously a member of the board of directors at Gannett, Inc. from 2014 to 2017. Lydia, thank you so much for being here with us. Nanette Cosero, let me read your bio as well, at PhD. Do you prefer Dr. Cosero or just Nanette?
Just Nanette is fine.
I asked that because I know the amount of effort that goes into getting a PhD, not because I've done it, but because I know people who have, and I want to be respectful of that. So I will absolutely call you Nanette. Let me read your bio a second here. So as the global president of Pfizer Vaccines, Nanette is leading the development, commercialization, and delivery of innovative vaccines to drive the prevention of serious and life-threatening conditions. With over 25 years of experience in diverse leadership positions, Nanette is a recognized global leader with broad commercial and business acumen, coupled with an extensive clinical background and scientific experience. Nanette's experience includes leading global teams of over 3,500 colleagues and managing diverse portfolios. In her current role, Nanette leads over 30 billion global business and manages a diverse vaccines portfolio aimed at protecting lives at all stages, from infants to older adults. Most recently, Nanette has been responsible for the development, global commercialization, and delivery of more than 1.8 billion doses of Pfizer-BioNTech COVID-19 vaccine to 149 countries and territories around the world. In addition to vaccines, Nanette's vast experience includes working across multiple therapeutic areas within specialty and primary care. As a world-renowned expert in global healthcare, Nanette is an experienced and dynamic speaker, presenting on global health topics at major events, including Aspen Ideas Health Social Good Summit and World Health Summit in 2020. Nanette served as a chair of the International Federation of Pharmaceuticals and Manufacturers Association, Vaccine CEO Steering Committee 2019-2020, advocating for policies and practices that foster vaccine innovation and discovery. She has been instrumental in establishing deep relationships and partnerships with governments, civic organizations, and others in the biopharmaceutical industry. Throughout her 20-year tenure at Pfizer, she has held a number of senior positions touching every market of the world, from development to emerging markets, and has led business operations spanning Pfizer's core therapeutic areas, including vaccines, oncology, inflammation and immunology, internal medicine, and rare disease. Before joining Pfizer, Nanette was a management consultant in the biotech and pharmaceutical industry, and she earned her Bachelor of Science degree in chemistry from Cornell University, a PhD in pharmacology from the University of Pennsylvania, and an MBA from the Wharton Business School. And she has lived and worked in the continental United States, Puerto Rico, and Spain, and is bilingual in English and Spanish. Thank you both so much for being here. In today's conversation, we're going to start a little bit of an introduction. We heard a little bit about your bios, but I think the journey is really the magic, right? I would love to hear from you both. Lydia, maybe we can start with you. What's your journey from where you started to how you got to where you are today?
Damien, thank you. I think it's, I appreciate the opportunity to have this conversation. And I'm also excited that two of us, my friend and colleague Nanette is joining me for this discussion. I would tell you my story is a classic immigrant story. I was born in Mexico. We moved to the US when I was 10 years old. And I grew up in Southern California. And my family came to the US in the hopes of a better future. And like many, the promise of America. I lived in the inner city of Los Angeles, which helped me to appreciate people from all walks of life. And interestingly enough, I actually learned to speak English by watching soap operas, The News, and Chips. If you remember Chips.
Yes.
I was fortunate enough to have a great English lit teacher in junior high who encouraged me to apply to a magnet high school in the San Fernando Valley at the time. And while my new school was a 90-minute bus ride twice a day, it was certainly worth, that sacrifice was certainly worth the education that prepared me for Berkeley, where I earned my undergraduate degree. I went on to earn dual master degrees, a master's in business administration and a master's in business informatics at one of the few schools at the time that offered both of those at the time, which brought me to the Netherlands. And following that, I joined Philips Healthcare after graduate school, and that began my career in healthcare more than 20 years ago. And I have been in the industry ever since. More recently, I spent a little bit over a decade in the diagnostics part of healthcare and served as chief information officer of two of the largest diagnostic companies in the US, LabCorp and Quest Diagnostics. And in January 2019, I joined Pfizer. And I can share that I am passionate about applying digital data and technology to improve health outcomes. That has been a theme. And I would say a second theme for me is it's about the power of knowing. And data and analytics really do something besides connecting dots about patients and about disease and about medicines and treatments. It's about the power of knowing, because if you know what is going on, it actually helps you to make decisions. And, that, as we know, can make the difference between a healthy outcome or even life and death. That was a big driver for me joining Pfizer, the tremendous impact that we have on the health of patients around the world. And that has been my journey. Besides the bio that you read at the beginning, it's really this passion for ensuring that we leverage digital data and technology for the better good or the greater good, and also to improve health outcomes around the world.
I love that. And I want to circle back to you in a minute after we talk to Nanette about her journey around, I love, you went to the Netherlands. You said that almost like, sure, I went to the Netherlands. I think a lot of people potentially have opportunities to go places where they feel scared about taking that leap and jump. I'd love to talk to you more about that as we go along this conversation. Nanette, over to you, right? Your journey. How did you get to where you are today?
Well, Damien, thank you. Thank you for, again, including me with Lydia in the conversation today. And yes, I am a very proud Latina. And similar to Lydia's, also have an immigration story. I am a mother of 3 grown-up children who have now all graduated from college, and I've been at Pfizer for 20 years. I was born in San Juan, Puerto Rico, but I spent much of my childhood in Spain and was educated in both countries. Because as I mentioned, I'm a child of immigrants. My mother is from Puerto Rico. My father is from Spain. And they have always instilled in me the idea that anything is possible and a strong sense of responsibility to contribute positively to society, right? And this is what led me to pursue an education in science. And while I was at the University of Pennsylvania, I was part of the pharmacology PhD program, as you mentioned. But I also had a growing interest in business and a curiosity about the kind of impact that I could make outside of the research lab. And then that's when I decided to enroll to get my MBA. And yes, it definitely was not a conventional choice, but my long-term goal was to make a profound impact on global public health, and which is still the same goal that drives me today. And I saw a path through the combination of both science and business, and then ultimately joined Pfizer because I believe that the work that we do at Pfizer, delivering breakthrough medicines and vaccines, as you mentioned, to have a profound impact. It was exactly what I was looking for. So in my current role as global president of Pfizer Vaccine, like you mentioned, we are committed to making a impact on global public health. And it's a huge motivation for me in this role as we're making, a world that is more equitable place. And yes, that is why I'm so energized to join this chat with you today.
No, I love that. And I have to say, I'll tell you personally, and a lot of folks in the ALPFA community, I've heard the conversation around hearing about Latinas that were so critical in, opening our world back up, right, through the vaccine was something that was empowering for folks to hear that both of you were doing that. And so Lydia, as we have this conversation around, business leadership, and yes, there's a focus on Latinas because you two are Latina. I think there's just a general leadership conversation that's happening here, right? So Lydia, I'd love to understand, how do you find the courage to take that jump to go? I'm assuming you had never been to the Netherlands before, right? Right now, I hear so many people having the conversation around finding their passion, finding their responsibility in life based on their skill set and what they should be doing. But sometimes it's a little scary to take that leap or that jump. How do you find that courage to do so?
And, Damien, it's you made me, think about this, because at the time when I was considering graduate school, I always knew that I wanted to do graduate school. And I can tell you that initially I had my sights on studying the law and being a lawyer. And it was after I graduated from Berkeley that I worked at Sony. And I had a great mentor at Sony who took me under his wing and exposed me to a lot of different aspects of business, from marketing to M&A. And he had me go work with the IT team at the time to go solve a big issue that was keeping him awake at night. And I remember, and I went to go work with the IT guys to figure this out, and we came up with a solution. And that was a pivotal moment because I realized two things. One, again, this idea of data and connecting dots. And the second realization for me at that point was that I'm a solutions person, that I enjoy, coming up with solutions. And no matter how, scary the problems or hairy the problems are, it became a bit, it kind of realized that that's who I am. So then when I did the research and I started to look, okay, if data, in my mind, data is going to be the oil of the 21st century, as best as I could tell at that point. And then I did my research, and there were not many schools that had the dual degree. And I really wanted to be able to do the dual degree. And there were two schools, one in the UK and one in the Netherlands, that offered, this dual degree. And you're right. It was one of those moments where you have to jump and you have to take you where your passion is. And yes, it was scary. I remember showing up, to the Netherlands, flying in from Los Angeles to Schiphol International, and I was not even dressed properly because it's a bit colder in the Netherlands. But I had my two suitcases, and I got to tell you, it was one of the best experiences. Yes, it was scary, but at the same time, it opened my eyes, and the experiences that I gained there were just so amazing. And the people that I met, because the school that I went to, 90% of the students were coming from outside of the Netherlands. And the language was officially English for the program that I was in. And so yes, it was scary, but I would tell any of you listening, take those leaps, especially at that stage. I don't have any kids. I'm not married. It was a great opportunity to go and meet people, learn a new culture, and I would say jump in. I've never regretted that. And it was, some of the best experiences that I've had.
That's phenomenal. Then I want to keep going on that sort of path a little bit. I would assume that you didn't grow up saying, I'm going to be the global head of vaccines for a global company. Along the journey, I'm sure there were times where you had to also take risks to do things. What's your thought on the willingness to take risks, the leap that Lydia talked about? Have you seen that happen for yourself? What gave you the courage to make it through? And what, any tangible advice you'd have for our listeners right now?
Yeah, well, no, absolutely. Like I mentioned, the combination of the science with the business was not the traditional path to continue going forward. So that was an area that I needed to convince several people, among them my thesis advisor, that it was the path for me. That was one point that I did take a risk, and another point was already being at Pfizer. One of my experiences was moving to Spain to lead a business in Spain as part of Pfizer organization. Yet it meant uprooting. At that time, I had already my 3 kids, and my husband had a senior VP role at JP Morgan Chase. So I needed to convince him that this was the opportunity for us as a family. And he did take the leap with me. We went to Spain. It was also scary, like Lydia mentions. Again, is my husband going to find a job? Are the kids going to get used to the school there? While we tried to be bilingual at home, their English at that time was not that strong yet. But then again, when you go and go with really an open mind to really leverage the opportunity with an optimistic outlook and what the future can bring, really very little is impossible, right? You can all definitely make it happen, and that has been my experience and is my recommendation for our women, for our Latinas to never hold back and definitely go for those opportunities that bring you to new experiences and new learnings, whether it is at your personal level or at your professional level.
Yeah, I love that. And I'll say, Lydia and Nanette, you both, it's subtle, but it's tied in both. You mentioned a lot of people along the way, right? You didn't necessarily give specific names, but you don't need in that. Having that support network around you, I would say, was a big part of you being able to take those leaps and jumps. Would you agree? Yeah. Absolutely. So very tangibly, right? That have that support network that you build up. Make sure that you are willing to take that leap and jump and believe in yourself. That's what I heard through this conversation so far, right? Very, very tangible things that people can take moving forward. Let's shift back into the career area for a second, which, although that hit in the career absolutely throughout the whole thing. Lydia, I'd love to get your view on what are one or some challenges you faced through your career, and how have you gotten past those things? Is there one you'd like to share with us?
Sure. Typically when I'm invited to join a company is for transformation work. I have, one of the characteristics of who I am is change agent and transformation. So I'll focus my, response related to that, because I have learned a thing or two about it, after helping with transformations at several companies. What I found is that the greatest challenge is in a transformation is bringing people along on the journey. Resistance to change is a natural part of the transformation process, and it can be difficult and uncomfortable for people to adapt to a new way of doing things. What I've learned is the best way to get people to come on the journey is to share the vision for the future. But not only share the vision of the future and what does the future look like, but also why we need to change. The why becomes also really important. And how it will benefit the company, our customers, but also each of us, right? And so what I've learned is that most people have the capacity for change if you keep them engaged throughout the process, if you get their feedback, and you get them vested into that transformation and provide them support along the way. Transforming a company and its culture takes a few years. So it's important to share success stories and celebrate incremental wins along the way. And then, and this is to me, one of the most gratifying parts of the journey is that as people start to see the tangible outcomes during the transition, they often become the biggest proponents of a new way of working and a new way of doing things. That's probably the biggest challenge that I have faced, having done a number of transformations in healthcare for a couple of different companies.
I appreciate that so much. I was taking notes over here because, we as an organization, we're going through a pretty big transformation ourselves from a digital standpoint. And everything you were sharing there really hits home in terms of what's needed to make it be successful. So thank you so much for sharing that. Nanette, is there anything that you'd like to share in terms of challenges that you've seen or you've faced or over your years to be able to get to where you are?
Sure. Yes. No. Absolutely. I think that I'm going to focus a little bit more on the challenges of representation. Growing up, like I mentioned, my parents always told me that I could achieve anything I put my mind to, and I believe them. But I step out into the corporate world, and I found that there were very few women in leadership roles, right, and even fewer Latina leaders. So as you might have heard, the quote from civil rights activist Miriam Wright Elderman that I think is very relevant. She says, "You can't be what you can't see," and representation does matters, right? And I want the next generation, including my own daughters, to have a different experience, right? And this is why discussions like this one, that what we're discussing today, are so very important to encourage the next generation of leaders. And we need to continue our work to increase awareness and recognition of Latinos as key contributors to society in all areas of innovation, and for all to feel very proud of what we have achieved and what we will continue achieving, because I am a true believer that the best is yet to come.
I love that. So let me keep going on that with you, Nanette, for a second. So I think sometimes we don't pat ourselves in the back often enough to look back on the accomplishments. It's always like, what the next one. Is there anything that, as you look in your career, that you are very proud of that we may not have known? We heard your bio. There's a lot to be proud of in that bio. Is there anything that you would like to share, or that you can share?
Well, I mean, maybe you already know this, but I want to continue emphasizing, the pride that I have in the opportunity to lead the Pfizer vaccine business, right? Through this very unprecedented time of the COVID-19 pandemic. It is such a pivotal moment in history, right? And has been the greatest, really, honor of my career so far. Again, like you mentioned, I became the global president back in January 2019. But of course, back in January of 2019, I never imagined how much the world would change a year later, right? And while the pandemic as a whole has been a difficult experience for all of us to live through, it has brought out the best in so many people. And we have seen healthcare workers and first responders truly go above and beyond their call of duty. And we have seen breakthrough innovations in technology and of course in medicine. And we have also seen people from across the industry collaborating together. And this is something that I'm very proud of, because it's not something that has been going on as often as it should before the pandemic. It's definitely going on during the pandemic, and I'm very much looking forward for it to continue going forward. Hopefully after the pandemic ends soon, I'm hoping. So as a leader of Pfizer, I can say that I've never been prouder to work at this company and at a time where we've made, like you have heard several occasions, our CEO, Albert Bourla, say the impossible possible, bringing forward a COVID-19 vaccine just 9 months after the pandemic was declared. And now we're seeing our COVID-19 vaccine being rolled out across the world. And I am incredibly proud of my colleagues and our partners at BioNTech for helping to bring this breakthrough to patients in record time without ever compromising on safety.
Yeah.
So yes, I mean, it is all those unsung heroes that I am extremely proud of, that I've gotten a chance to see them in action and to see the great contributions that they have done throughout this period of the pandemic.
Yeah, it's amazing, and I think it is important to call it one more time, right? For those that don't know, a Latina that is in a very senior position with I Love You, working with a team to make it happen. Right. And that is so critically important, to the point of someone may watch this and they may bring their, young daughter to take a look at the video also and be like, wow. And all of a sudden you have a whole nother generation of folks that want to go into the sciences, and it could be fantastic there. Lydia, there's also for you so much that you have accomplished. Is there anything that you are particularly proud of that you would be able to share? Because I think it's so important. So often we just keep our heads down and keep getting the work done and don't recognize the amazing things we've done in our lives and careers.
Sure. As I mentioned at the beginning, right, it has been my passion to apply digital data and technology to improve health outcomes. I would say a couple of really high moments of pride. one in a prior role in the diagnostics arena, where we created an innovative brand and portfolio of healthcare IT and data products that delivered critical insights to improve health outcomes and improve patient care. And what was really good about that is that we were able to grow our core business. We earned credibility as an innovator, and we were actually able to create new business out of that venture. So that was, a very proud moment. Yeah. Like Nanette, I'm also very proud of what we accomplished during COVID at Pfizer. I can tell you that, especially you triggered me, Damien, when you said, kind of behind the scenes, there's so much that goes on. I can tell you that practically overnight, our team transitioned 80% of our workforce to remote work to keep them safe, but also to continue to deliver those critical medicines to patients, right? And the other thing that we did is harness digital innovation across all aspects of our business to accelerate the COVID-19 vaccine effort, from powering our science with AI and analytics, to leveraging digital to conduct the clinical trial, to harnessing digital to scale up the manufacturing so that we could actually track all shipments and also the temperatures of our doses anywhere around the world. As Nanette said earlier, we have shipped, 1.8 billion of those doses so far. And then also, very importantly, being able to engage virtually with patients and physicians during the pandemic, right? Because we needed to. And, probably the moment of pride from all of that effort was when our Chief Scientific Officer, Michael Dolston, said, "Science will win and digital will help us do it faster." It was quite a proud moment. I will tell you, from a people perspective, I am very passionate about encouraging women to enter STEM careers. So, for example, as a sponsor of Girls Who Code, I spend time with high school girls to open their minds to the positive impact that they can have on the world through STEM careers. And then finally, on a personal note, I am proud of the work that my family has done to support the Latino community. One program that has been particularly significant to me personally is a mentoring program in inner city of Los Angeles at a park where I actually used to play. And I recruited fellow college graduates to tutor local students in subjects like math, English, and science, as well as help, high school students with college entrance requirements, tests, and applications. Because I remember when I was going through that, there was no one at my home who could help me with that. And so, as I look back, it's amazing how fulfilling it is to support a young person standing where you stood many years ago in their educational journey to improve their life. That is an amazing moment of pride as well.
Yeah, I love that. I was gonna say, have you had a chance to reflect? And it's so important to be able to reflect back on what's happening. Like I said towards the beginning, I mean, it is, I'll say for myself, it's an honor to be able to have this conversation with the two of you, knowing the impact you've made globally, but also the impact you're making, I'll say this, with the things that people don't even see that you're doing to help, right? In the community, conversations like this. So again, I thank the two of you for all of that. And as we're talking about the community impact, and Nanette, you were talking about the vaccine, I'd like to shift it back over to there a little bit, in talking about that. How are we ensuring that we're getting diverse representation with respect to clinical trials, right? The importance of that diversity in that aspect.
Yep. And Damon, thank you for your question. It's a very important space that we have been putting important effort and purposeful effort. We know that in the past, diverse communities have long been underrepresented in clinical research, unfortunately, for various reasons, which is still a source of mistrust about how vaccines might affect people of color, right? And it was therefore essential that with our pivotal COVID-19 vaccine trial, we made it a priority to enroll a diverse population, one that reflects the diversity of the world we live in and is inclusive of communities that have been disproportionately affected by COVID-19, like, as we know, the Hispanic Latino community. First, we were very purposeful in where we established the clinical trial sites for our vaccine trial. We established global sites in countries like Argentina and Brazil. Plus, in the United States, we have sites in states with high population of Hispanic Latinos like Arizona, Florida, New York, and Texas. Beyond this, we took active steps to engage our community, partnering with trusted grassroots organizations like Hispanic Federation and Dia de la Mujer Latina to raise awareness and understanding about the importance of clinical trial participation and develop patient-focused Spanish language materials that we knew that perhaps language was a barrier to participation. So throughout the enrollment process, we track our progress publicly on our website in Pfizer.com. And if you go there, you will see that 26% of global participants and 13% of US participants actually enroll in our phase 3 trial were Hispanic and Latino people. So generally speaking, Latinos account for up to only 1% of clinical participants in the past. And I am so very proud that in our trials, it was 13% of the US participants that enrolled being from Latino communities. So I truly believe that the example that we have set with our COVID clinical trial program will help build confidence in vaccines and advance health equity in the future, and that we will take these learnings for the rest of our pipeline portfolio.
Outstanding. Thank you for that detailed explanation. So your point, so critically important to have that parity, and 13% is an amazing leap forward. So a lot of work must have gone into that, as you described, to make that happen. That's fantastic. Clearly, from that conversation, and I will also say engagement with organizations like ALPFA and others, Pfizer is definitely a company that has a strong commitment to diversity, equity, inclusion. Can either of you share some of the ways Pfizer creates opportunities for your colleagues to excel and achieve their aspirations in their lives?
Sure, I can start on that one. So, our purpose, breakthroughs that change patients' lives, drives everything we do. And we realize that means not only working in the best interest of our patients, but also attracting the best and brightest talent. It means ensuring that colleagues can thrive in an environment and culture where we champion diversity, equity, and inclusion. In 2019, we launched our 2025 Opportunity Parity Goals for both women and U.S. minorities, making concrete commitments. And I'm pleased to share that we're on track to achieve those goals. One of our aspirations is to be as diverse as the patients and communities we serve. So aside from hiring the best people, we're building a talent bench that will ensure diversity in our workforce. So a couple of examples. In April, we launched the Breakthrough Fellowship Program and several rotational programs designed to create opportunity and equity in underrepresented groups at Pfizer, particularly Black, African American, Latino, Hispanic, and those of Native American descent. The Breakthrough Fellowship Program, it's a first of its kind, includes an undergraduate summer internship with wide-ranging opportunities in R&D and marketing, in global supply, which is our manufacturing disciplines, and more. And after graduating from their undergraduate program, candidates have an opportunity to join Pfizer full-time while preparing for graduate school. Then they are eligible for a fully funded graduate degree program with a paid internship and full-time employment upon graduation. We've set our goal to grow 100 fellows over the next 5 years who represent future leaders for Pfizer. So we're not just thinking about today, we're also thinking about sustainability over time, right? We also have rotational programs in digital, as well as science, research, and development. And this is one of my favorite programs, actually. We provide a diverse set of early career colleagues with a series of on-the-job learning experience and training, and in various roles over a 2-year period. That means they graduate from college, then they join us. In those first 2 years, they will rotate. In the case of digital, we rotate them in 4 rotations of 6 months each to give them an opportunity to figure out, what they're passionate about. So they can do an internship, not an internship, they can do a rotation in digital marketing, in analytics, in software engineering, in learning and development, the different disciplines that we have. And that investment, right, it's been great because we've been running that program now for 5 years. And we have been able to retain a very, very high percentage of those rotational associates because of the investment that the company makes. So the way we see it, the future of medicine is happening at Pfizer. And we're always seeking opportunities to innovate and grow our team. And, Pfizer is an amazing place to work. I can tell you that. And as you heard, Nanette has been with Pfizer 20 years. I do hope that ALPFA members will consider joining our team. I think we have great opportunities across different disciplines. And I think it is an amazing place to work.
Yeah, I will say from my standpoint, you're not just just talking the talk. You're walking the walk, right? And it is phenomenal. And I think they were showing the little sign. If we could pop that back up for a second over here, I think it's careers.pfizer.com. Just making sure people know where to go to be able to identify the opportunities and be able to connect in. Because it sounds like, to your point, there's a lot of future and a lot of things happening at Pfizer, and there's some great leaders there, which are the two of you and many others that are working there. And it's been, I will say, a phenomenal relationship thus far with ALPFA, and I look forward to continuing to work together to see opportunities that can be created. As we start closing out, I love asking this question, so I'm going to ask each of you if you could just share. Is there any piece of advice, closing advice, that you would have? And I'll say, especially for Latinas that are watching this section, to be able to, anything that you just want to make sure you let them know before we close out. Nanette, I'll start with you, and then Lydia, I'll shift over to you.
Okay, well, if there is one piece of advice that I consistently give to people starting their career, especially in light of the conversation that we have had today, is this: always be you and bring the best version of you every day. There is no substitute to authenticity in all aspects of life. And to the next generation of Latina leaders, especially remember that your voice matters. Stand up for the causes that you believe in and be that change maker. The world is listening, and it is your time to shine. Reach for the stars and don't let anything or anyone hold you back.
Love that. Thank you, Nanette, and love the energy there. Lydia, any closing advice, guidance, words, inspiration you want to give?
Sure. I'd like to offer 2 important pieces of advice that have helped me in my career. And one is very business, and the other one is more personal. The first one is ruthlessly prioritize efforts that focus on customers and deliver tangible outcomes. That's my first piece of advice. If you do that, and you focus on the customer and you focus on delivering tangible outcomes, you find that it's amazing what comes out from that combination. And the second piece of advice, I truly believe in the importance of building your personal brand. Be clear about what you stand for and be thoughtful about how you show up. And that your personal brand is going to be an important way. It's your projection of not only who you are, but also who you aspire to be as well.
Lydia, Nanette, thank you both very much for taking the time to be with us today. I hope everybody enjoyed it. I know I got a page of notes over here from the conversation myself. Thank you so much for being with us here in this Alpha Live. Thank you to Pfizer for sponsoring this section for us, and look forward to continuing the relationship. And have a great day, everybody.
Take care.
Thank you, Damien.
Thank you so much,
Take care.
Damien.
Bye-bye.